it's unbelievable how much kidney disease just takes over your entire life.
That affects tremendously. The last 2.5 years that I've been on it, it has not been the most pleasurable thing that I've ever went through in my life, to say the least. It's very time consuming. It's also very intrusive in a person's life, and it's not very much fun to sit there. It's not the idea that you sit there for 4.5 hours, 3 times a week. It's that after you do that, it makes you very weak. And it takes you a day to sort of recover, but unfortunately, then you have to go back the next day. So you start all over again. It's sort of like a roller coaster. And I'm looking forward to seeing what the men's bathrooms look like in many of the places that I go to.
The prospect of the transplant has had very little effect on my everyday life. Certainly it's impacted my father more than me. He's the one who needs the kidney. I'm just giving it.
We do a transplant mainly for 2 reasons. When in those individuals who can tolerate a transplant, when you compare transplantation with dialysis, transplantation provides 2 main benefits. First of all, it allows the recipient of the kidney transplant to live longer, to have a better survival. Second, it allows the recipient of the transplant to have a better quality of life. Let me give you an example. Let's suppose that we have a long weekend, or that somebody wants to go in a cruise and leave town. For somebody on dialysis, it would be impossible to leave town for a long weekend or to go, for example, on a ship for several days unless they can arrange for dialysis wherever they're going or for dialysis on the ship. From a public health perspective, when you compare the cost of transplantation and dialysis, transplantation is cheaper than dialysis. Sometimes although we may want to donate an organ, we cannot, because to donate an organ, you have to be very healthy. We have to make sure that you can continue having a normal life after you donate an organ. There are people who have had children after donating organs. Everybody should continue with their normal life after donating an organ. So we need to make sure that for those who donate organs, that they can continue with their normal lives.
So I think it's important for people to learn to talk about transplants, because right now there's a lot of stigma and just misinformation around the whole process. So, for example, when I went into this field, I really didn't know a lot about transplants, and when I looked for information about it, there really wasn't a lot that I could find except from patients themselves telling me about their stories. And one of the stigmas that I held as a person that had never been through this experience was the fact that I thought if you were an organ donor, if you were in critical condition, that doctors weren't gonna help you as fast as someone who wasn't an organ donor, because they wanted to potentially take my organs out because I was an organ donor. And that's simply not true. You can be an organ donor and someone else can be an organ donor, and doctors are gonna save you just as fast as someone who isn't an organ donor.
Well, it's not just kidney transplants, it's transplants in general. There are many, many, many people who are suffering and waiting on lists to get transplants that will make their lives so much better than it is now.
Again, these are just normal kids who unfortunately have these issues going on. Every family is different, so it's really important to understand that all families and their stories as far as with transplantation and on dialysis, it's important to have the support system and to have a consistent and solid transplant team, which is why I really enjoyed my role as a social worker in the transplant and dialysis unit, because I really enjoyed helping the families that sometimes didn't have the best support systems to know that there was someone else they could rely on in their journey.
I'm very excited of getting the new kidney and having life the way it was before my kidney stopped. I know that there's going to be many other changes. I'm going to have to be taking numerous pills. I talked to the doctor and he says roughly about 10 new pills I'll eliminate a couple that I have now, but the anti-rejection pills, that I'll have to take for the rest of my life, even though it's my daughter and we're very close matched. You have to do these things anyway. But these particular, and this is the nervousness comes in, these particular medications that you take, the anti-rejection pills, it's ironic that they actually kill the new kidney that you're putting in. So that's why I have to go to the, after I get the surgery, I have to go for the first couple of weeks or a month. I have to go like 2 or 3 times a week, and I have to check my blood level, because they have to give me enough of this medication so that my immune system still works, but not too much that it would kill my kidney. So there's a fine line in between that they have to maintain to all the medication. And they said I'd have to go back there, like for instance, the first month maybe, the first 2 weeks maybe 3 times a week, the next 2 weeks maybe 2 times a week, and then after that for 3 months. And then after those 3-month period, then I can go to my own nephrologist who was close by.
Most excited to get it over with. Get to the hospital, get it over with, be there, have it done. Of course, most nervous for all the things that could go wrong. Not really for me. On my end, it's a rather simple surgery, but for my dad. So, just kind of that moment when he's done and out of surgery and they can come out and let me know that everything went well for him. That would be the thing I'm both most nervous and excited about. After the transplant, I plan to go to Disney World, I guess. Isn't that what people do after big events in their life? After the transplant, I'll be in the hospital for a couple of days. My dad will be there just a couple of days longer, and then we'll come home and recoup.
So I think people should take out this documentary that, so like in my opinion, I think the actual surgery is, for some of the families, like the most relieving part, and, after like everything they've been through, sometimes, the easiest part of the whole process, because actually leading up to the transplant is sometimes the most difficult part for families. There's a lot of things to take into consideration, and part of my job was really to establish if families were ready for the surgery, ready to take on the tactics as far as, medication compliance, having someone there during the surgery, having someone at home to take care of them during surgery. If there's a donor and a patient, like Olivia's family, having someone to take care of the donor and now the patient as well. All stories are different, so I would really encourage everyone to look into transplantation and donation and see the patient's stories when they are available, because it's really an amazing thing to learn from these kids and also adults.
I think what we'd really like to tell the world is that it's easier than they think to be a living donor. The impact on the donor is minimal. As a matter of fact, most research says that the impact on the donor will help them to live actually longer lives than they would have had they not donated the kidney. So I'd like to tell the world that it's easier than they think to do the living donation.
I think what they should take is that they're not numbers that are waiting for transplants. These are people just like you and I. These are people who live next door to you. These are your uncles, your fathers, your aunts, your sisters. It hits both genders. It hits people in different social and economic status in our society. It's not fixed on one type of people. It hits everyone. And they're people. They're people who are suffering. This is what I think people should take care out of this, is that we're all people, we're individuals. And if people were to donate more, it would make other people's lives much better.
The fact is that when people do die every day, and it's an unfortunate circumstance, but the fact that when you do die, you can save someone's life is something that's really an incredible thing.
Donating a kidney, it's something that only a hero can do. People who donate kidneys are the heroes of the 21st century. It's a beautiful thing to do, and we should all consider it.